Hi everyone, thanks for stopping in and seeing what I'm up to. My name is Nikki B and I am glad you are here with me. We're going to finish the book today, Borderline Personality Disorder. This might be a lengthy video / audio, but we are going to get the conclusion and all the other little tidbits that come with that. So, hang in there, and if no one's told you today, I love you, and I am proud of you, and I know you will succeed in anything you are after. Let's continue.
Chapter 35, Depression and its Connection to Borderline Personality Disorder. Borderline personality disorder has depressive traits, among other symptoms, in that the patient is subject to the feeling of failure, refusal, and isolation. Additional signs include 1. The likelihood that people have hidden motives. 2. Strong feelings that people are going to manipulate for evil reasons. 3. We can't work with other men primarily because of the two factors above. 4. You have a very low opinion of yourselves, like the person suffering from depression. And 5. You are usually hostile to people. While they're full of doubt about others, they don't realize that this assumption is unfounded, that it has no relation to reality in their minds. Cyclical bouts of anxiety and depression are experienced, but these moods do not last long. If you like, they are a borderline personality disorder brand. I have proclaimed a need for loneliness, but being alone scares them. Patients are always threats of suicide and should watch for suicide all the time. Around 1% and 3% of American adults are believed to suffer from this disease, but little is known to support it. In the 1940s and 1950s, borderline personality disorder was so named because it was thought to be at the verge of neurosis and insanity. This has been disproved since then. It is considered such a severe illness that the United States may have been proclaimed as the Borderline Personality Disorder Month by the House of Representatives. That makes things doubly complicated is that the disorder is so little understood. What is learned is largely based on empirical study. In most cases, the patient is liable for or subject to change between anger and anxiety or between depression and anxiety. You find it very hard to control your emotions. The trist part of it is that most of them yearn for intimate, caring relationships, but destroy their chances because of their unexpected fits of anger, their mood swings, and their impulsiveness. Another odd symptom is that they sometimes see themselves as inherently bad, even cruel men. We just don't exist at other times. The nearer they have to the relationships of love, hate, given that they see all in black and white, it's important. There aren't any gray areas. Gray areas are, of course, key for compromise in our structure. Normally, we compromise 20 to 30 times a day without knowing it. If we do not, we would sit at each other's throats all the time, and that is exactly the state of the borderline personality. They make a statement with which they fly into anger if you disagree. Like the person with a bipolar condition, the borderline personality tends to be risky. You love pace, you drive as fast as you can. They play and take drugs, the latter in dangerously high doses. The only reason the doctors have been able to propose so far is that of biology, which is rather lame. The dad had the disorder, and his son can also be subject to it. Environmental, childhood abuse history, and abnormalities in the brain. The last explanation seems quite obvious. The question is, what part of the brain or combinations of components cause the problem? Serotonin may not work properly, they say, but all of this is stroking. Together with autism, this disorder should be at the forefront of the study list in order to find a successful solution. It destroys the lives of too many people, not only the poor, but also their families. Chapter 36, Borderline Personality Disorder Treatments. Borderline syndrome of personality is an illness. This is a disease that affects the emotions of an individual. People's mood is highly disorganized, their behavior often changes, and therefore affects personal relations. The the problem of the self-image, behavior changes, and disorganized relations between the people affect and the others characterize it. It is difficult for these people to control their feelings and damage themselves. Women are more likely to develop this condition than men. Cause of BPD. The exact cause of borderline personality disorder is unclear. Some of the identified causes are abandonment, abuse of children, or trauma. Persons affected by this disorder have been abused in their lives sexually, verbally, physically, or emotionally. Such misconduct could have been committed by one parent or guardian. This condition may also be caused by the death or retirement of a parent or guardian of a child. Genetics have been shown to contribute to the restricted personality disorder. Individuals who are affected by this condition have a parent. It is also known that if one of the twins is affected, the other can also be very affected. Brain disorders. Brain chemical dysfunctions that help control moods may lead to the disorder. One such chemical is serotonin, which makes you feel happy. Symptoms of borderline personality disorder. People affected by this illness always see extreme situations. A circumstance can be called either very good or very poor. I also often switch their views on other people. You will be seen to use them one day, and the next day it will be the other. This makes it difficult to establish relationships with others that lead to instability. Individuals with this disorder are often very sensitive to how others treat them. Often, they don't take criticism well. Their self-image also changes. It is positive for 1 minute and negative for the other. Their behavior is quite unpredictable. It involves gambling, shopping, unnecessary expenditure, drug and alcohol misuse. Suicide cases and self-harm cases are also common. Mood swings, fear of renunciation. People often feel lonely and cold. Issues in anger management. Always get into physical fights. Diagnosis. This condition is diagnosed after a detailed examination by a psychiatric doctor in the patient. Diagnosis also includes psychological evaluations and assessments of signs and symptoms. In order to be diagnosed with this condition, at least 5 signs must be shown. This condition is linked to adults rather than children. Care. Treatment is provided in a number of ways. The use of medicine is one of them. We do not cure it, but we assist in patients' depression and anxiety. Antidepressants and anti-anxiety medications are commonly used. They must be prescribed by a doctor and closely supervised. Personal talk therapy is another way to deal with borderline personality disorder. Cognitive behavioral therapy is an example of this treatment. The health concern associated with drug and alcohol addiction presents America with a major challenge, and the overcoming of the problem becomes a daunting task for federal and state governments with prevalent disorders among addicts. Borderline personality disorder, BPD, is a severe co-occurring addict disorder. BPD could be described as an emotionally painful disorder characterized by emotional dysregulation, interpersonal relationships, actions, modes of thought, and dysfunctional self-images. Individuals with a borderline disorder can tend to lose their temper, have cognitive problems, and become addicted to alcohol or any drug. Such factors can lead to addicts' harmful behavior. And in such a situation, people may end up feeling weak and insignificant while being strong-willed. It changes the view of yourself completely. Accordingly, almost 50% of people with BPD were previously accused of involvement in prescription drug abuse, according to the 2014 Substance Abuse and Mental Health Services Administration SAMHSA survey. Keeping the related problems into account, BPD care is an increasing process for counselors. Challenges. In care, patients with a combination of borderline personality and substance abuse may try to resist treatment. This could pose a roadblock to a long-term treatment plan. In some cases, the patient's aggressive behavior may lead to life threats. In co-occurring patients with depression, approaches such as cognitive behavioral therapy and dialectic behavioral treatment may be helpful. Often, patients may also need medicine. Lee N.K., health consultant at the National Drug Research Institute, Curtin University, Perth, Australia, reports that dialectic behavior treatment, DBT, and dynamic deconstructive psychotherapy, DDP, are among the most promising treatments. An established dual diagnosis therapy center incorporating care and management will increase retention rates for recovery of patients. The relationship between client and therapist has been quite strong in patients with BPD and drug abuse disorders. Therapists have difficulties in entering into a therapeutic relationship with these patients. Different patient moods can prevent a cordial relationship between the client and the therapist from forming. There may also be a degree of passive or active treatment resistance in such patients. You may stop attending sessions, even demotivate the therapist's power. High relapse ratio. A retroactive prevention plan focuses on the prevention of self-harm, non-compliance, and risky behavior according to various addiction trends. Dysfunctional relationships. A person with a dual diagnosis needs love and attention. Nonetheless, patients fear losing their loved one due to a dysfunctional interpersonal relationship, and this usually adds to their problem. Families should be trained and made aware of the support for the recovery process. Suicidal thoughts. BPD and substance dependence people are more likely to attempt suicide and experience self-harm or self-mutilation. To treat these cases, a comprehensive approach, including crisis management strategies, should be considered. We do need adequate residential treatment. The stationary dual treatment centers provide BPD patients with soothing therapies. It is important to seek assistance from hospitalized double diagnosis treatment centers in order to address issues that lead to mental disorder. Borderline personality disorder is a disorder with which to function very difficult. Those with this BPD find it difficult to control strong emotions and to establish positive connections with those closest to them, such as important people and families. BDP is a relationship epidemic and abandonment issues are at heart. There are several excellent therapies for the diagnosis of BPD. DBT, dialectic behavioral therapy, CBT, cognitive behavioral therapy, and medications are the most common treatment methods. DBT focuses on teaching people how their thoughts and feelings are better managed. It is often performed with a trained professional in group settings. CBT aims to counteract negative BPD-related thoughts and behavior. Medicines are designed to address the effects of BDP, often depression and anxiety. Drugs are seldom, if ever, only used to treat BPD, and counseling often teaches people to handle the condition more effectively. Every combination of these therapies is ideal for the effective treatment of the condition. I've learned from many people who report BPD relief after a DBT intervention in my experience as a therapist. Help for BPD leadership is also available through the Quest for Support groups in your region. Through consulting with your psychologist or looking online, you can find borderline personality disorder support groups. Support groups are useful in BPD. Individuals will build relationships with other people who have similar problems and learn to work with them. You can call your local NAMI too. NAMI stands for the Mental Illness National Alliance and is an excellent resource for people with mental health and their families. It's a great way to learn about mental health problems and learn about the support and services available in your community. Approximately 2% of all people suffer from borderline personality disorder, and 20% of the population is in psychiatric hospitals. This is often seen in puberty, marked by mood instability, disruption of the self-image, and moral responsibility. This condition is supposed to disappear by maturity and successful development of personality. Although a limited personality disorder is not an incapacitated mental condition like schizophrenia, most doctors find it a very severe disease because the damage a person can inflict on him or her during the height of stress. Roughly 9% to 75% of those diagnosed with a restricted personality disorder have self-mutilation, drug addiction, depression, and suicide. About 8 to 10 million of this population who pursue self-destroying habits actually die. Such troubling findings inspire medical experts to deal with mental illness by effective treatments. Psychotherapy is the first line of treatment prescribed. It allows people to control their emotions, take their lives into account, and use constructive coping mechanisms to overcome challenges. The psychotherapy plan uses no suicide to reduce the possibility of death and at the same time encourage the client to overcome his own despair and, if possible, to seek support. In addition, psychotherapy is an outlet for mental rehabilitation, which corrects a person's negative and dysfunctional view of himself or her and her environment. Hospitalization is recommended in extreme cases. Severe depression leads to suicide and success in a person with borderline personality disorder. Constant monitoring and immediate medical attention are needed to prevent this. Hospitals and mental institutions have the services needed to ensure the safety and health of the patient. Such facilities also have appropriate staff who can meet and respond to patients' needs in a way that would be most therapeutic. Together with psychotherapy and hospitalization, drugs are used to manage the disruptive effects of borderline personality disorder and improve the well-being of the patient. For brief psychotic episodes, low doses of antipsychotic drugs are given to people with borderline personality disorders. Antidepressants and anti-anxiotics are also prescribed for specific emotional disorders. Chapter 37. The 7 Steps to an Efficient Borderline Disorder Therapy. Do you suffer from BDP and wonder what is the right BDP disorder treatment for you? Here you will know the 7 key steps to be taken. Phase 1. Stabilization. The first phase is to regulate the feelings and the psychological distress. This can be achieved with specific techniques such as controlled breathing, relaxation, and meditation. Both activities relax the mind and the body to be more receptive to the following processes. Phase 2. Medicinal drugs. When tests are inadequate at Phase 1, medicinal products can be of real help when used in the proper way, though you must remember to take no drug and no amount because they are relatively addictive and may have serious side effects. When taking any medication, please visit your GP or doctor and use them only under your supervision. If you do not do so, you are exposed to high risk of further mental and/or physical issues, then you have to deal with them later. Phase 3. Identification of BPD symptoms. At this point, the underlying causes of BPD are identified and discussed in the treatment of borderline personality disorders. The origins of BPD are usually found in complex emotional and mental aftermaths during the first years of life. The triggers are generally self-represented emotions, beliefs, and attitudes that obstruct everyday activities. Phase 4. Discussion. If causes of BPD are known, they must be debated and contested for their validity to be confirmed. Different approaches, such as logical debate, are used in this company. Test their safety in practice and evaluate their usefulness from a pragmatic point of view. Phase 5. Change. This is the step in which the process of transformation starts. As you know, life begins with a shift in our perspective. They act like a sieve, which is only passed through the physical parts of a certain length. If you want more, you have to change the sieve. Phase 6. Implementation. The necessary changes found during the previous step will be implemented at this point. What this process really does for you is that it helps you create new mental and emotional patterns for everyday life so that you can use them without questioning each step. This will make your new, healthy self your second nature. Step 7. improve your overall life. You might have heard that people with life cycles goals live 5 to 7 years longer than the average. Okay, this is real because when you are busy and creative, you activate your energies in a way that your health and happiness are high. Personal development approaches are therefore used at this final stage to achieve the full potential. When healthy and imaginative, human spirit and body are the best. Chapter 38. How to cope when your loved one suffers from BPD, borderline personality disorder. Those who suffer from BPD, borderline personality disorder, deeply affect their loved ones. One minute you feel like you're going on eggshells all the time and never know how your loved one reacts to a situation or you, with love and anger or anger. BPD is a severe and often life-threatening disorder characterized by severe emotional pain and emotional difficulties. BPD's issues include impulsivity, including suicide and damage to oneself, severe negative emotions, including frustration and or guilt, unstable sex, intense fear of abandonment, and related difficulties in maintaining a stable and reasonable sense of self. The best way to deal with BPD is to try to understand what BPD is and what it impacts the patient. It is always easy to be frightened of the unknown, so as much as possible about BPD, its symptoms, and what a person with BPD suffers. Most importantly, realize that it is not personal when they reach you. Obviously, even if you realize that you understand BPD, you will need to learn how to deal with your own feelings of betrayal, hurt, and shame triggered by the actions of your loved one towards you, and that some people will think that you have hurtful comments. Sadly, the BPD sufferers have short memories of good things, but you always remember the bad things and your implication in them. It is difficult to deal with the impression that you are just as good as the last thing you did. If you have ample influence and control in the life of the client, you need to help them make the decision to seek care. We must take responsibility for their BPD and know that there is trained support there. The things can be better and that they can manage their life. This is very difficult to do and therefore the hardest aspect to deal with, as the very nature of the condition prevents the individuals from seeking help. This produces negative sentiments for the person affected, and those who try to help themselves, causes low self-esteem so that he doesn't feel worthy of assistance, and gives him a black and white view of the world, which means that at the first visit he might dismiss the doctor as no good. What if I can't persuade them to receive treatment? There are many support groups not only for BPD patients, but also for those living with or close to a BPD patient. Sometimes it helps only to share the burden. In any situation, communication is key, but here it is particularly important. Communication with the BPD sufferers to help them understand what they are doing. All this is essential to help them cope with the stress of loving the suffering. Conclusion. Most different psychiatric disorders suffer from there. One psychiatric disorder that I found interesting is borderline condition. The condition is known as a disease of the personality. Like many personality disorders, there are many reasons why the symptoms can occur. Psychologists agree that this condition starts in infancy or adolescence as the symptoms last long. The negative effects of these symptoms may not be observed until the patient is an adult. The symptoms of BPD are typically seen clearly during adolescence, especially when the person is a young adult. A person with borderline personality disorder can also have a record of inconsistency in life. There is also a very high chance that when you are a child, the disorder patient has suffered violence in the family, neglect, and sexual abuse. Borderline personality disorder is diagnosed more in women than in men, and I suspect that this may be because women are more often victimized than males, which is why it is very likely that the patient has been abused as a child. Another explanation why I conclude that this condition is more often diagnosed in women may be because women are more likely than men to go to care. This condition can affect the life of the victim and make it difficult for him or her to function properly with his his or her friends and family, and anyone they have a relationship with. The effects of BPD can have a negative effect on the relationships, mood, and self-image. Such condition leads to bad or negative self-assessment, very impulsive relationships, and the constantly changing moods. The sufferer's life will be severely affected as they often fear being discarded, and to overcome this feeling, one would easily bind themselves to others, feel helpless, always feel in need, and participate in the lives of other people. When the patient feels that he cannot cope with the fear of abandonment, he or she will drive people out of life to avoid being rejected by them. We would then do all they can to help the people back to their lives, and the cycle continues when they are powerless and again in need. Individuals who have a relationship with an adult who has this condition often have to leave because they are unable to cope with their acts. As they leave, the client then feels worthless, unloved, and vulnerable, and even more is perpetuated by their misguided perception that they are useless and unwanted. If this cycle continues, suicide and begin to be considered, counterfeited in order to get attention and be rescued, to try to remember people, cut off and participate in other self-harming processes. You may feel depressed and angry with yourself and others. You may also have trouble handling unpredictable behavior. A person with borderline personality disorder needs to be treated to live a healthy, normal life. Individuals do not like to live with a disability and want to change in order to work more effectively in their community as successful adults. It takes a long time before the person gets better in treating a person with this illness, as this disorder typically affects a person for a longer period of time, inhibits his ability to live a normal life, and causes him to develop bad habits because of his condition. Psychologists agree that insight-oriented counseling is useful for a person with BPD, but more recent research supports more active cognitive behaving therapy. Through cognitive behavioral therapy, the client and a psychologist monitor a person's thoughts and actions. With their thoughts and actions are registered, a plan for the individual is created based on the behaviors. The strategy will, if implemented, mitigate the negative thinking and behavior of the disorderly person. To be even more successful, both methods may be included, but both methods take a lot of time and, most importantly, effort. If the individual wants to be successful, he or she must be willing to take the medications for the condition, is more likely to recur if he or she refuses treatments. When medication is given, a prognosis would then be expected, but a prognosis is very difficult to come up with. If the patient is pursuing his or her therapy plan, improvement can be over time, and the patient can gradually begin to change his or her patterns and behaviors. Bad habits, a person's attitude and attitudes are hard to significantly change, particularly when done for a long time. But with time and effort, one's poor habits can at least be reduced to a more natural, healthy life. For those dealing with borderline personality disorder, long-term treatment is strongly recommended. When you want to be better, your therapies have to hold on, and your bad behavior will over time change, allowing you to live a comfortable life. Would you think you may have BPD or borderline personality disorder? Okay, you might have personality characteristics that are usually shown by people with the disorder. BPD requires a consistent pattern of thought and communication between a person and his environment, like other personality disorders. This behavior usually causes many issues and can affect the capacity of the sufferer to handle himself or to cope with life. The pattern for borderline personality disorder is usually distinguished by unstable views about oneself, behavior, sentiments, and the ability to interact with others. BPD has previously been seen as a number of signs and symptoms, including both psychosis, distortion of reality, and neurosis, mood disorders. It is never seen by people as a disorder bordering on psychosis and mood disorders. Nevertheless, it has now been found that the condition is more similar to disorders of personality, especially the way it evolves and happens in families.
Thank you, everyone, for hanging out with me and listening to Borderline Personality Disorder, the complete guide. and tools to BBT to control the emotions, the anger, and the depression. No one's told you today, I love you, and I know you'll succeed. Thank you for hanging out with me. Like, subscribe, and comment today. Make sure you leave a comment on what books you would like to listen to next. Again, this was the conclusion of Borderline Personality Disorder. Nikki B signing off.